grim milestone in this country with 250,000 deaths, and it's growing. And so we're going to have a frank conversation like we always do about what we're doing here and what's going on in New Mexico. So Nora, would you put up my first slide, please? Okay, so you can see that the new cases are incredibly alarming. People should expect, we've been talking about that these numbers are going to keep increasing, right? You know, it's a dimmer switch. You can't turn it on and off, which is why we really have to take this reset incredibly seriously. 3,675 new cases. And remember what that really means. It means that you're going to see more hospitalizations and more deaths in the state of New Mexico. This is the worst possible news, and everyone's got to just do a better job. And I appreciate that we're all working hard to do that. We've got 74,116 total cases statewide. Today, we have 12 additional deaths. That brings us to 1,302. And again, this is the only time I get to say publicly that we mourn with these families. And I know that New Mexicans, based on the information we can provide that does not release a person's identity, that you can see that folks are getting younger, that the underlying conditions are to some degree not as severe as they were for, say, an 80 or 90-year-old who we might have lost early in this pandemic, who we still might lose through this pandemic, which is just untenable, and we've got to do better. But we're seeing this really hit home hard with populations of all ages. So I just want to reiterate, this is a deadly virus. And in addition, it is also a virus for far too many people is leaving chronic conditions that are preventing individuals from being able to go back to work. Hospitalizations, we have 774 as of Thursday. Notice this number. Early in the summer, we were talking about, double digits on ventilators, often well below 20, 125. Please also bear in mind that we know that the mortality rate, the risks here, or serious long-term chronic conditions related to lung damage and related internal organ damage from being on a ventilator is incredibly high. So this is a number we need to push in the other direction. And we also need to have a healthcare system that can deliver services for New Mexicans. Next slide. I'm going to try to get out of the sun. I think I did that a little. All right, I wanted to give you a slide that gives you a sense about how rapidly this is spreading, and that didn't do it at all. This is what happens, guys, when you're by yourself. Bear with me, New Mexicans. I'm learning to try to do this myself. Let's see if I can, I think I might have figured it out. This is high tech here, everyone. I am here completely alone, as I should be, because we're trying to minimize exposures, but it makes it tricky. All right, this is a really, I think, important slide because it really gives you a sense about why we're in a reset and how critical this exponential spread is. Take a look on the slide and see that it took 98, so just under 100 days to get to 10,000 cases. In just 7 days, we went from 60 to 70,000 cases. So 100 days, 10,000, 1 week, 10,000. That's how fast this is spreading. The best defense against the virus is to stay home, stay isolated. If you have to go out, distance, wear a mask. The virus is everywhere. It's looking for an opportunity to spread. spread with you. Next slide. Okay, I also want to show you that when we have infections, because we still are having a debate, which I have to, in earnest, tell the Mexicans, I don't understand this national debate. Even if you're asymptomatic, and even if you're one of those individuals who catches this virus and has no symptoms ever, or very light symptoms, having the infection means it's spreading. Spreading this infection means more people will die. And this is a gruesome slide. Take a look at the number of deaths, right? So we have this in increments of 200. The beginning of the pandemic, it took 46 days. Then remember, we were really working hard to crush, prevent a spike, to crush it, but we were having some community spread. Then we had 200 deaths in 28 days. Then we did really well, right? We did really restrictive access, much like we're doing right now with our reset, right? Look at, we extended it back to the very beginning, a month and a half, 45 days, 200 deaths. And we held that. And in fact, we did better for several months. Right now, nearly 2 months, 200 deaths. 14 days, 200 deaths. 1 week, 10,000 cases, 14 days, 200 deaths. This is the outcome of that exponential spread. And if we don't, and we're going to, if we don't get this under control as quickly as possible, you're going to see 200 deaths in 7 days. And that exponential gruesome number will grow, but it doesn't have to. Next slide. All right, so we want to just do a quick review of why we have a reset. We did that actually, but what does it really mean? We thought this graphic might be useful. So you can see that where it says open, we've got little icons: grocery stores, healthcare, pharmacies, restaurants, to go and delivery only, so no in-person dining. Childcare, hardware stores, because if your heater breaks or your plumbing breaks or we're in critical construction, we have to make sure that those tools and supplies are available. Veterinary services, auto and bicycle repair. People have to be able to get to the grocery store and get to their medical appointments. Banks, post offices, laundromats, and shelters. These are all the things that are open, all are critical. I know that we debate essential versus non-essential. It's the way in which most of the states, including New Mexico, talk about the critical services that are without them, we can't eat, stay warm and safe in our homes, travel to our medical appointments, et cetera, right? So these are things that are always open. Here's what's paused, right? You can't be in group gatherings more than 5, so that didn't get any bigger. That stays the same. On-site, in-person dining, can't do that. Only to go and delivery. Workplaces, if you're essential, you can go, but absolutely, if you can telework, we need you to do that. Have a conversation. If you're the manager, help us get to this place, or the CEO. If you're an employee, bring it up if that's still going on, because it shouldn't. And offices that are not part of this essential open group, you've got to help us do better by minimizing person-to-person contact. Gyms are paused. Group fitness classes are paused. Group athletics are paused. Indoor malls, big box stores that are not selling food, museums, salon spas, and services of that nature, tattoo shops, pet grooming, and recreational facilities. Now, I know that when we look at that paused component, and it feels really basically unfair, it will, and that we aren't able to both express our economic footprint and employees. It diminishes their opportunity to go to work. This is tough, and small businesses struggle. But if we don't do this, we overwhelm the healthcare system. We don't have any first responders. There isn't anyone to provide childcare or services in a nursing home. There aren't enough ambulance drivers. And quite frankly, we're beginning to see that in necessary businesses like grocery stores, that when all of the employees are infected with COVID, they cannot be open, which means we're losing access to critical services and supplies. We have to crush this virus again. Next slide. I didn't do as well a good a job with this as I had hoped. Okay, this is a slide that I hope you find as meaningful as we do in the modeling team and in our public health team, because it really shows that the 14 days is critical to also stopping the spread. And we have far too many New Mexicans who are not isolating or are falsely reliant on one negative test early on in what's a potential incubation, right, and cycle for this virus. So I want to take you through it really quick. So day 0, Ashley is exposed to COVID-19. She doesn't know she's been exposed, but on day 4, because someone's tested, we do contact tracing, she learns from the Department of Health, the Public Health Division, that she was exposed, and we ask her, and she complies, that she should self-isolate. All right, then on day 5, Ashley gets tested for COVID, because when we call you in contact tracing, we recommend that if you've been in close contact, you should get tested. Now, her results on day 5, they come back negative. Great sign. She has no symptoms, feels good. So on day 8, because she's got a negative test, she thinks she's okay. So she goes to work, she goes to a small family gathering. And remember, Ashley doesn't know she has COVID. She isn't doing this on purpose, but it feels safe. She's contagious, even though she has no symptoms. In this scenario, on day 8, she's now exposed 11 people. Now on day 10, Ashley develops symptoms. She gets tested. She's positive for COVID. And so we're hoping that in this scenario, you can really see that this timeline of incubation up to 14 days is really challenging to actually get this done. But if we don't have New Mexicans, particularly in our contact tracing efforts, really understand this and really work to achieve this, we're going to keep spreading this deadly virus. Next slide. All right, so I want to talk a bit about Thanksgiving, because Thanksgiving and the sun is relentless where I am. I can't seem to do it, but and I apologize to the viewers. I don't want it to be distracting, and I want you to be able to see these slides. We are asking the Mexicans to come together and to make the safest possible decisions this Thanksgiving. And I know it's hard because we've had 8 months where we can't be with our friends and families. We haven't been able to travel. There's been no meaningful familial celebrations as we've fought against this deadly virus. This holiday is going to be like all the others. It's going to be hard. But here's some ideas. We can support our local businesses. Order your meal, pick it up, curbside delivery. You know, we're supporting local restaurants and businesses. This is critical and will go a long way to help deal with their economic burdens because of the pandemic. Do everything in your power not to mix households. I know that that's asking a lot, because Thanksgiving is exactly how we celebrate, bringing our families from multiple households together. This is ripe for spreading this virus. So I know that I've already said it, so I'm not going to read these again, but mixing means if you're coming into contact with your non-household members, even if it's small, even if it's outdoors, isn't going to be enough, because you got to take masks off to eat Thanksgiving dinner. It is really, really high risk. And it's something our modeling team is incredibly concerned about. And again, let's not forget that we can do a better job supporting our local businesses. Okay, next slide. All right, I believe that this next slide is going to be Dr. Scrace, which will give me one more chance, Dr. Scrace, to get out of the sun. All right. Thank you.
Governor, either you should get out of the sun or you should put on some sunscreen. Okay. All right, I'm going to share my slides again here, and hopefully we'll be good to go. I wanted to touch on a number of topics today. It's going to be a little different and a little bit the same. We're inundated with cases that has really overwhelmed most of our systems for processing them. Although we've made some good progress with automation, and so hopefully that's going to help us going forward in some areas. First update is just new evidence really suggests that masks can also protect each one of us when we're wearing them. You know, you heard me say for months and months that the primary purpose is to protect others, and that's still true. Masks are even more effective protecting other people from you if you have COVID. And remember, you could have it now and not be aware. Not everyone has symptoms. A good percent of people don't have symptoms. So do remember that. Second thing is that as a wearer, you can be protected from others if both of you are wearing masks. With someone you're with, that's a dramatic drop in either person's risk of getting COVID from the other. Multiple layers of cloth, please observe that. Makes a huge difference. Not just a thin layer. I've seen people wearing masks where I could actually see their teeth, and those are not going to work. They're not going to prevent spread. And there are other materials you can read more online. Polypropylene, for example, can provide even more protection. So a lot of healthcare masks are sort of a fabric, polypropylene fabric, sort of tri-layer type of construction with various materials. Something to think about. I want to deal with two questions I got this week about masks while we're on that subject. Number one is someone asked me, we heard about this person who was really good. They wore their mask all the time. They still got COVID. That means masks don't work, right? The answer to that is absolutely not true. And now it's assuming that person did wear the mask the whole time, no reason to doubt it. And they did get COVID. Masks aren't perfect. I mean, healthcare workers doing aerosolizing procedures wear very high-grade masks that really do protect them. But masks can reduce your risk of getting an infection by 75%, but not 100%. So remember the other things about 6-foot distancing and avoid being with others indoors, just as important. The other question I got this week is, we've had a mask mandate for 8 months and our cases are at an all-time high. Isn't that a proof that mask mandates don't work? And my answer was and is, the public health orders themselves don't reduce the number of cases. It's New Mexicans complying with public health orders and doing what they say that reduce the number of cases. And so while you'd think, and it is better if 70% of us wear masks, it makes a difference. But once cases get out of control, our ability to stop that spread declines fairly significally. If you have 3,000 cases in a day, and you're in your state, and you're going to go out, and I'll show you a little bit more about that. So masks absolutely work. Please wear one. Please tell the people that you love in a very nice way to wear them as well. That's just a really important basis and it's something we can all do. Not everybody is a contact tracer or a doctor or a nurse or a public health expert, but every person can wear a mask. Okay, my next slide is looks a little bit sciencey. Pay attention to the left side. If you want, you can look at the right side. But CDC also released a report about transmission within households. The governor talked about, very important point, if you are going to be with people from another household, everyone should wear masks. It doesn't really matter if they're in your family or not. If you're mixing people with another household, people should be masked. This study, looking at spread in Tennessee and Wisconsin, showed that if someone in a household has COVID, there's a 53% chance that someone else in the household will get COVID. So those precautions, if you have someone in your house who's sick, everyone should wear a mask. If you have someone in your household who's sick and has been tested for COVID, everyone should wear a mask till you have those results. If you have someone in your household that's been exposed, probably everyone in the household should wear a mask till that 14 days is up, like the governor described. Very important. And I know it seems intrusive. We just went through a stint of everyone in our household wearing masks for a week, and it felt very awkward, and I wasn't a big fan, but was also aware that that was an important thing to do for every person in our family and every single person that every person in our family would contact in their work or school or whatever. So, and then the last thing is, a lot of people, as I said before, can have coronavirus and not have symptoms. That's just as true in your own home as it is out in the rest of the state. So please think about those conditions. Think about applying them within your own house. No matter how awkward that seems, with the case counts we have right now, it can help reduce spread. Last week, the folks at Georgia Tech put an interesting online calculator online. I'd encourage you to go take a look at it. But basically, it says, and you can enter different numbers and try different scenarios, but you can calculate, if you go to a gathering of 10 people, what are the chances that at least one person there will have a coronavirus infection, an active coronavirus infection? And the numbers are higher than I was expecting, and maybe you were expecting, and it does vary by county. And we're not picking on counties. We just took a representative range of counties here. But you can see that in one county, there's a better than 50% chance that someone of those 10 people in that meeting will have coronavirus. And also remember, don't forget that one person, even if you feel good, could be you. So think about that as well. But these are high numbers. You know, I like to, it's not the perfect analogy. And so I'm saying that up front. You don't have to send me an email about it. But, you know, let's just take Eddy County, 33% chance of someone there being COVID. No one would fly on an airplane that had a 33% chance of going down, right? And so we need to take more precautions. 33% is not a low risk of getting a potentially fatal disease. It's a very, very high risk. With that, I'm just going to move on to a couple of routine slides. I've gotten used to saying to ignore this line here. There is a 6-day lag. Remember, we had those 2 low reporting days, a Saturday and a Sunday. They're just working their way out of the data. In a couple more days, this curve will be back up, and we also retropopulate. This is by the day the test was done, so as tests come back in. So basically, if you ignore the last 4 days here, steady upward trend. And you also know that even if we got an average of 1,317 cases and we reported 3,675 today, and in the 2000s, the past couple of days, that we are still on our way up, which is going to be a challenge for us because that trajectory continues. Remember, the curve doesn't come to a point and go back down. It rounds off first, and we're already straining our system at the levels we're at. Continuing, this is the daily case rates for 100,000 people. And as you can see the proportions here, highest rates still in the 18 to 34-year-old age group, but the high hospitalization groups, 35 to 64 and 65 and over, also continue to trend up sharply. I said, I don't think this is going to level off like it looks like it would. And sure enough, those numbers have gone up as well. The cases are in every age group. This is the distribution of cases. What percent of all coronavirus cases have been in which age groups? And you can see here still highest, 20 to 29, continually increasing numbers, 16.9%, highest it's ever been in the 0 to 19-year-old group. And deaths, again, most likely, 35% of our deaths over 3rd in the oldest age group over 80. But we need to recognize today the very, very sad addition of another death of a 12-year-old in our state from coronavirus. Just, you know, a very tragic event, of course, for the family and for all who knew that child. Because of the uniqueness of the case, I can't really provide you any additional information to protect the confidentiality of the individual, but we're all very sad. And on that note, also, Alex and I do a teleconference for doctors and other care providers every Tuesday. And Alex came up with the idea of using art and other artistic representations just as a break from the steady pressure of coronavirus. So each week we show a slide, and physicians and others send in slides and we show them. So this one came this week, and I thought it was particularly pertinent today from Dr. Mark Unverzagt. He said, I took this photo during the recent snowstorm a couple of weeks ago as I reflect on the yellow leaves on the snow, something we so rarely see in these numbers. It reminds me of the lives lost prematurely due to COVID-19. The reed in the center of the photo bending under the weight of the snow is a metaphor for so many aspects of our society struggling at this moment, trying not to break, like our healthcare system currently. And I'll say more about our healthcare system, but thank you to Dr. Unverzagt for sending that in. I wanted to share that all with you today. It's been a meaningful moment of reflection for me about our situation here, and the fact that these yellow leaves are in the snow or something we never see. We've never seen anything like this in New Mexico in 102 years, and hopefully we'll not see it again in 102 years, but it is our reality and what we're living with now. Mobility. Since the beginning of the pandemic, the sawtooth line here is 1 point for each day of the week. So Saturdays and Sundays are always lower. When we initially did a shutdown, we saw it took 4 weeks, but a significant decline in mobility, how much people drive around in the state. And that allowed us to get the pandemic under control. The reset that basically started on Monday officially, more announced. We have not seen that sharp drop off yet, but I'll be back with this graph next week and we'll see how we're doing. One piece of good news is we're starting here, we're level with what was about halfway down the curve. So in 2 weeks, we could potentially get down to that lower level of mobility that will allow us to get these cases under control. Now, this will be the first week I don't go through the gating criteria. Obviously, we're not thinking about reopening. You all probably know what color most of the metrics are. So instead, I'm just going to show you a few slides on hospitalization. Number of people being cared in inpatient settings continuing to go up. The governor mentioned the fact that our hospitalizations are now higher. We did change our reporting method. We're going to real-time data from hospitals first thing in the morning about how many COVID positive patients they have or suspected, severe enough respiratory illness to be in the hospital. Both have the same effect, by the way, on the delivery system, but we're using just the confirmed cases for what we report. This graph is both, and you can see this relentless upward progression that's only going to keep going up, as the governor mentioned, as we see the case counts climb. I hear from an awful lot of people that the whole idea of case counts is or hospital bed availability is grossly overstated or understated from a mathematical perspective, and that we have, quote, lots and lots of hospital beds in our community. So here's what it looked like this morning. Here you can see by community the number of available general hospital beds, not ICU, where we could put a COVID patient. We typically have about 2,500 general hospital beds. In New Mexico, we're down to 60, in the 2 to 3% range. So I'm not sure where you live, where they have lots of cases, and you can see Santa Fe up here, which, probably many of these beds are already filled, but this is a situation we're in with a lot of communities with no available beds whatsoever. This map is the same basic count on the ICU side. And again, some serious issues. This is a blow up, this insert of hospitals in Albuquerque with a little bit more detail. But, if we have 3,500 new cases a day and, 35 to 50 people get admitted to the hospital every day, There that some people will be discharged, but it's a 7-day length of stay. So we are really pressing up against every place being full. And one thing we talked about this morning too is we can't put negative numbers in the system. So if a hospital has 15 people being cared for in the hall and another 20 people waiting in the emergency room, that's still a 0. It's not a minus 35. So we want to get you those numbers just to dispel these rumors that there's a lot more beds out there. And these are staffing available beds, which we've talked about is our shortage. So we do have to double down. This rise in the cases is just people being with people, maybe wearing masks, maybe not. We've got to keep working on this. Please stay home. Please rethink your plans. Our family's been doing virtual holidays for a long time because the kids live all over the country, and so we've done that for years. Sometimes we travel, sometimes we don't. This year, nobody's going to be traveling here for Thanksgiving, and it talks about this virtual meal with friends and family who don't live with you. A Zoom Thanksgiving is better than an intensive care unit Christmas. And so please, I love Thanksgiving more, just as much as any of you. I make this killer green chili pinon nut stuffing for the turkey that everybody loves. Probably still do that. The 3 of us will eat it. But please don't mix families this year. It's 1 year. 1 year. Help us get through this. Help protect our healthcare workers. Be creative about what you can do to spend time together, to love each other, even if it's not in the same room. And I know not everybody has that capability, but reach out, connect with family. But this year, wear masks. If you do mix, remember the limit is 5 people. And if you can't do that, then stay separate, talk on the phone, do a Zoom call, and connect that way. And with that, I think, Governor, I'm going to turn it back to you and for questions.
Thank you, Dr. Grace. Thank you, New Mexicans, for your patience with my high-tech moving away from the sun effort as I was trying to move the camera. I mean, we were all doing our part, and we are minimizing and contact of state employees, even critical essential workers. Dr. Grace, myself, you can see he's at his home office, and I'm at my home office setting, and there's nobody here. And everyone needs to think about strategies that will help us prevent the virus from moving with us in any capacity or context. And before we go to questions, I wanted to just highlight 2 more things. The country is at a breaking point. New Mexico, remember, we have less of everything, and we could debate about why that is. It's frankly tied to some old Medicare reimbursement regulations in the 80s. But be that as it may, it is where we are. I can't change that. We can't make a nurse where there's not a nurse. We can't get a pulmonologist or a specialist where we need one if there isn't one. There's just so many people available. And I also know that many New Mexicans, and I want you to keep doing this, have worked to get tested and can't. It is full. Testing sites aren't open. And I have 2 things to say. And happy to answer questions about that. One, it's exactly what we don't want. We are working immediately to expand testing, but it's exactly that issue, that when you have this exponential increases, we run out of actual people to do the work that's necessary to carry out operations like testing and getting them to the laboratories, and then getting all the information and uploading it correctly into databases, and then making sure that people get notified, and then making tens of thousands of calls for contact tracing, and then navigating placement for people who need isolation and sheltering, who can't do that at their homes or need hospital care. So, I mean, it is hours worth of work that can't get done in a day for 3,000 people a day who have this infection. However, and we're fixing that. So Balloon Fiesta, actually I got that wrong. As an example, Expo will now be open nearly 8 hours a day, 6 days a week, half day on Sundays. So you might say to us, and more of that is coming, why don't you just do that? We don't have the people to do that. It means that we really have to figure it out. So a couple of really important shout outs. Firefighters are responsible nearly 100% for getting us to a place where we can expand our large testing apparatus and sites in Bernalillo County. If they weren't willing to help us with the registrations and the swabbing and all of that goes into effective samples, right? Getting those samples and then getting them to labs, we could not do this. And I have no doubt that firefighters statewide are going to stand up and help us. Remember, when they're doing that, they may not be available for another emergency. So we are stretched incredibly thin. Also know this, with the number of infections, that means firefighters got an infection. And they were paramedics, right? They were responding to a call for somebody who was infected. So this has ripple effects in ways that are really difficult to manage. And at some point, and we are basically there, they are not manageable. So it means New Mexicans have to do more to help the state, make sure that we have the resources to support and protect you. So firefighters, thank you. Here's another huge shout out. You know, these are the unsung heroes, much like our first responders and healthcare workers. You know, the public health division of the Department of Health, our doctors, our nurses, our technicians, our trained advocates, our epidemiologists, our virologists, this whole incredible team is in fact really small. And they provide day-to-day healthcare screening and services in any number of other ways, not related to this pandemic. They also provide flu vaccines, right? I mean, they do a ton of work. They haven't had a day off in nearly a year. They're working impossible hours. I frankly don't know how they're doing it. They get up every single day. They don't ask questions. They don't fight against the realities of this pandemic. They just keep delivering day after day after day. And in fact, they're doing that all over the country. And so, you know, when you see a public health office or you see a public health fan, honk and wave, thumbs up. They are doing such incredible work. It is selfless. It is exhausting. They are our heroes in this design, and I can tell you that there is no way we could do any of this effort to combat a pandemic without them. So I wanted to make sure, I often forget to tell them what a difference they're making around the country, what a difference they make in New Mexico. And in spite that difficulty and exhaustion, here's where they'll be on these holidays. They'll be running samples. They'll be seeing patients. They'll be giving flu vaccines. They'll be at a testing site somewhere. They're not going to get any holidays because their jobs dictate and demand that they show up every day for you. And they want to do that. But this is harder than anyone ever imagined. So I thank you for every New Mexican who can't personally thank you. And I appreciate that everyone watching gave me an opportunity to do that. Nora, why don't we go to questions?